Welcome. This short guide uses simple memory tricks to make reproductive health easier to learn and remember. Think of it as a set of smart cues that help you recall important ideas, examples, and practical points about human reproduction and related health topics. In this lesson, we'll cover the essentials: what reproductive health means and why it matters, how population explosion happens and how it can be controlled, the main types of contraceptives and how they work, common sexually transmitted diseases and how to prevent them, and finally, why good sex education is important. Reproductive health is best understood as total well being in all aspects of reproduction: physical, psychological, and social. Use the mnemonic P3H to remember the definition: physical, psychological, and personal harmony. For why it's needed, think pair: population control, awareness about reproduction, infertility management, and reduction of sexually transmitted infections. These are the core goals we work toward. In India, the Reproductive and Child Health Program brings these goals into practice. It focuses on maternal and child care, provision of contraception, and policies to support regulated population growth, all aimed at healthier mothers, babies, and families. Population explosion has several causes. Remember DILLB: lower death rates and rising life expectancy, high infant mortality in some areas, lack of education, and persistently high birth rates all contribute. Identifying these factors helps target the right interventions. To control population growth, we use the LEAF approach: legal marriage age to delay early childbirth, awareness campaigns to inform people, education especially for girls, and family planning services to enable informed choices about childbearing. Contraceptive methods are grouped into categories you should know: natural methods, barrier methods, hormonal methods, intrauterine devices or IUDs, medical termination (MTP) where allowed, and surgical options. Each group works differently and has its own strengths and limitations. For natural methods, use WPL to recall withdrawal, periodic abstinence, and lactational amenorrhea. Periodic abstinence means avoiding intercourse during the fertile window found by tracking ovulation. Withdrawal is pulling out before ejaculation. Lactational amenorrhea gives temporary infertility when a woman is exclusively breastfeeding and her periods have not returned. These methods typically have no medical side effects but offer lower reliability. And remember that abortion is not a natural contraceptive method. Barrier methods are summed up by CDDC S: condoms, diaphragms, dental dams, cervical caps, and spermicidal creams or jellies. Condoms are unique among barriers because they also reduce the risk of many sexually transmitted infections, so they are the only barrier method that protects against STDs as well as pregnancy. Intrauterine devices or IUDs come in copper and hormonal types. Think NCH as a Q for non-copper and copper/hormone options. Common copper devices include CUT and multi-load types. Hormonal versions include levonorgestrel releasing IUDs. Copper works partly by increasing phagocytosis of sperm. Overall, IUDs are highly effective and reversible methods of contraception. Hormonal contraceptives are easy to group with the mnemonic POI²: pills, injections, and implants. All of these act mainly by inhibiting ovulation or changing the uterine lining and cervical mucus to prevent pregnancy. They're effective when used correctly and are available in different schedules and formulations. When you think of sexually transmitted diseases, remember HSGHW, HIV/AIDS, Syphilis, gonorrhea, hepatitis B, and chlamydia are common examples. It's important to note that not every infection is sexually transmitted. For example, typhoid is not an STD. So, recognizing routes of transmission matters for prevention and treatment. Preventing STDs depends on a few practical habits: consistent condom use, avoiding multiple sexual partners, getting regular checkups, and seeking early diagnosis and treatment when needed. These steps protect both individual health and community health. Sex education plays a key preventive and supportive role. The Safe P mnemonic helps. Sexual maturity awareness, avoidance of STDs, family planning information, emotional balance, and prevention of abuse. Teaching these topics empowers young people to make safer, healthier choices. Quick recap of the memory tricks: P3H for the definition, PAIR for the need, DILLB for causes of population growth, LEAF for control measures, WPL for natural methods, CDDC S for barrier methods, NCH for IUD types, POI² for hormonal methods, HSGHW for common STDs, and SAFE-P for the goals of sex education. Keep these cues handy to recall the full concepts quickly. That's it for today. Learn smarter with EduRev. Notes, test, and practice in one app. Download EduRev now on Play Store and iOS App Store and keep learning every day.